Good day. I'm Dr. Arlene De Jesus, a pulmonologist here in Capital Medical Center. Tuberculosis or TB is caused by a bacterium called Mycobacterium tuberculosis. These bacteria usually attack the lungs and can attack any parts of the body, such as the kidney, spine, and brain. If not treated properly, TB disease can be fatal. TB bacteria can spread through the air from one person to another. When a person with TB coughs, speaks, or sings, TB bacteria can get into the air. People nearby may breathe in this bacteria and become infected. When a person breathes in TB bacteria, the bacteria can settle in the lungs and begin to grow. From there, they can move through the blood to other parts of the body. Symptoms of TB disease depend on where in the body the TB bacteria are growing. TB bacteria usually grow in the lungs, or what we call pulmonary tuberculosis. TB disease in the lungs may cause symptoms such as a bad cough that lasts for 3 weeks or longer, pain in the chest, coughing up blood or sputum. Other symptoms of TB disease are weakness or fatigue, weight loss, no appetite, chills, fever, and sweating at night. Some people develop TB disease within weeks after becoming infected. Other people may get sick years later when their immune system becomes weak for another reason. Generally, persons at high risk for developing TB disease fall into two categories. First category includes persons who have been recently infected with TB bacteria. This includes close contact of a person with infectious TB disease, persons who have immigrated from areas of the world with high rates of TB, children less than 5 years of age who have a positive TB test, groups with high rates of TB transmission, such as homeless persons, injection drug users, and persons with HIV infection. Persons who work or reside with people who are at risk for TB in facilities or institutions such as hospitals, homeless shelters, correctional facilities, nursing homes, and residential homes for those with HIV. The second category includes persons with medical conditions that weaken the immune system. This includes babies and young children who often have a weak immune system, HIV infection, substance abuse, silicosis, diabetes mellitus, severe kidney disease, low body weight, organ transplants, head and neck cancers, medical treatments such as corticosteroids or organ transplant, specialized treatment for rheumatoid arthritis or Crohn's disease. There are ways to prevent tuberculosis. First is vaccination. The BCG is a live vaccine against tuberculosis. This vaccine is prepared from a strain of the weakened bovine tuberculosis bacillus, Mycobacterium bovis. The BCG is currently the only licensed vaccine against TB and has been used since 1921. Next is early diagnosis. Early diagnosis and treatment are the most effective way to prevent the spread of tuberculosis. Next is case finding. Limiting the spread of TB depends on successful finding and treating people with the illness to prevent them from passing it on to others. This can be done through raising awareness of TB so people with TB symptoms know how to seek help. Next would be managing your environment. The risk of infection can be reduced by using few simple precautions. First, make sure that there is good ventilation, as TB can remain suspended in the air for several hours with no ventilation. Second, make sure that there is natural light in your environment, as UV light kills off TB bacteria. Third is good hygiene. Covering the mouth and nose when coughing or sneezing reduces the spread of TB bacteria. And last but not the least, a healthy immune system. Having a healthy immune system is the best form of defense against TB. 60% of adults with a healthy immune system can completely kill TB bacteria. TB treatment is effective. Worldwide, nearly 90% of cases of TB and 48% of cases of drug-resistant TB are cured. However, treatment is not quick nor easy. The length of TB treatment lasts at least 6 months. patients may begin to feel better within 2 weeks of treatment, and people with pulmonary TB normally become non-infectious during this time. However, it's vital that patients complete their treatment so that the TB bacteria are completely killed off in the body. This prevents symptoms from returning and the risk of bacteria becoming drug-resistant. For more information, visit our website or Facebook page or call our care concierge to schedule your visit.